This right here could impact over 90 million Americans, including nearly half of all children in the US, yet.
So, is Medicaid important? So let's watch this video, then we'll talk at the end of the video. And drop your comments. I'd love to hear from you guys.
I know you've probably already heard that Congress wants to cut $880 billion from Medicaid as part of their budget to give tax cuts to the wealthy. But what if I told you it's worse than you think? Nearly half of all children in the United States are covered by Medicaid. What happens when that funding is cut? Millions of sick kids without health care. Just what we need in the middle of a measles outbreak. Real family values right there. I was on Medicaid most of my life. My dad was always bouncing around different jobs, and I remember very clearly what it was like when we would get kicked off coverage because he made just a little too much money for us to qualify. I suddenly couldn't go to the doctor when I got sick. My younger brother has autism, and I remember my mom having to cancel his therapy appointments because they'd ran up too high a tab at the doctor's office. Yep, nothing more American than a child with a disability being unable to get health care because his parents owe the doctor too much money. And that's about to be the reality for millions. We cannot let this happen. There is an extremely narrow majority in the House. We have a chance if we can just flip a handful of votes. So I know you are tired of hearing this, but call your reps. Demand that they protect Medicaid funding, then call them again tomorrow and the next day. Because if we don't act now, millions of Americans are about to lose their health care coverage.
So when Orange Man takes away all of Medicaid and all of these community mental health centers are closing, what are we doing as professionals for a huge percentage of people? Because I've worked in those centers for years, and there are waiting lists, and kids depend on those services, adults depend on those services, and they depend on those services because they can't otherwise afford them. So are we just letting them go into society and withdraw from medication and totally just go to the prison system? Is that the plan? Are we supposed to absorb them into private practices and expect them to pay money that they don't have? I just literally don't understand. And we can't get money from the government to help take care of them, or grants or anything like that. So, and you guys are all about don't abort babies, but then who's taking care of these babies when they're born into houses that can't take care of them? The community mental health centers that you would like to close.
Asked if the Medicaid cuts are official, and that's a great question and a perfect excuse to explain reconciliation, or why Republicans keep saying that there's no mention of Medicaid in their budget bill while everyone else says that they're making cuts to it. I brought out the whiteboard, but it's going to be real simple. Trust me when I say that this is worth knowing, because you're going to start wising up to how you're being lied to. The first thing to remember is that Congress passes laws and budgets. They have the power of the purse. They're made up of the Senate and the House. In order for something to be passed, it has to pass both chambers, and then it gets signed into law. The Senate, which is made up of 100 senators, 2 from each state, has a very special rule called the filibuster rule, which makes it a lot harder to get things passed in the Senate. It says that even though you can pass a bill with a simple majority, you need at least 60 votes to end debate on that bill and move on to a vote. Which basically means that even if you're in the minority party, but you have more than 40 votes, you can actually stop a bill from being voted on in the first place by extending debate. It's a very effective way of obstructing things when you're the minority party. However, there are exceptions to this filibuster rule, one of which is a budget resolution and reconciliation. So what a budget resolution bill does, rather than being an entire budget with all the details already laid out that needs 60 votes in the Senate to get past debate and then get voted on, is that it basically sets an outline for the budget with goals for each committee. A budget resolution cannot be filibustered, so all you need is one vote with a simple majority. And then each committee goes and works on a mini budget covering the stuff that they're in charge of, that meets the goals or requirements set by the resolution bill. Then all those mini budget proposals are compiled into one giant reconciliation bill. A reconciliation bill is also not able to be filibustered. So once again, you just need a simple majority. So basically, this is a way for Republicans to pass a whole budget without needing a single vote from Democrats in the House or the Senate, which means they can do whatever they want. So right now, the House has passed the budget resolution, which basically gives the outline or the goals for each committee. So why is everyone saying that they're making cuts to Medicaid? And why are Republicans saying that Medicaid is never mentioned? Both are actually true. We can figure this out with simple math and logic. The House Committee on Energy and Commerce is in charge of Medicaid, Medicare, and a few little other things. Let's say this is their budget. Their budget is about 2/3 Medicare and almost 1/3 Medicaid. They also have a sliver about this big that's a bunch of other stuff. Let's use some easy to understand but made up numbers, okay? Let's say that this whole pie is $10. That would make Medicare, about $6 total. Medicaid, about $3 total. Everything else, about $1 total. To be clear, the ratio for this is actually a lot less than 1/10. And for the record, this also includes important health stuff, including the Children's Health Insurance Program. Remember, their goal is to extend the tax cuts that they passed in 2017, which already added trillions of dollars to our debt and will add trillions more. So rather than rolling back those tax cuts and taxing billionaires a cent more, they're trying to cut everywhere they can. And I'm all for budget efficiency, but we have yet to see an example of that from Republicans. What they did is that they told this committee that it has to cut $2 from its budget. But there's an obvious issue, right? Where are you going to cut $2 from? Even if they were going to start with everything else, right? This whole piece of the pie, including Children's Health Insurance Program. All that nets them is $1 in savings. So they still have to find another dollar somewhere in here. So take your pick. Are they cutting from Medicare or Medicaid? Because it's going to be one of them. When Republicans say that Medicaid isn't even mentioned in their budget bill, they're telling the truth. They're just banking on you not understanding how this works.
This right here could impact over 90 million Americans, including nearly half of all children in the U.S., yet lawmakers are pushing for one of the largest Medicaid cuts in U.S. history. If they succeed, millions of people, kids, parents, elders, people with disabilities could lose access to care that they depend on. Medicaid isn't just another government program, it's a lifeline. And it's the #1 payer of reproductive health care in America, covering birth control, pregnancy care, cancer screenings, emergency room visits, and life-saving medication. Medicaid is also crucial for pregnant people, covering 41% of all births in the U.S. Some of the lawmakers pushing for this massive cut claim to be pro-life, but there is nothing pro-life about this. Slashing $880 billion from Medicaid means that parents will lose access to prenatal and postpartum care. It means sick children won't be covered if they have to go to the ER. It means people's lives will be at risk. How can you call yourself pro-life while refusing to support healthcare that keeps people alive? If you believe that healthcare is a right and not a privilege, then take action at the link in our bio and join us in saying hands off Medicaid.
All right, basically what this video has just said, Medicaid is literally saving people's lives. Millions and millions and millions of people from around America. If they do the budget cut, if it goes through, millions and millions and millions of people in America are going to suffer, because literally it is helping people when they go to hospital to have access, whether it's going to the ER, whether it's getting prenatal care, whether it's getting those necessary medicine like diabetic. Literally it's saving people's lives. So do something. Call your Congress people. Make that call. Let's watch the video, and then please don't forget to subscribe.
You're so spot on about this, and I live in a rural state. I live in Nebraska, and I know also that the other thing that's going to be cut and that's going to close down in these rural communities is long-term care facilities. And we experienced this with my stepmother, who had Alzheimer's and was in a memory care facility in Nevada, Missouri, that we fought. We put a change.org petition together, my dad and I, and we all advocated, my sisters and I in the community advocated to keep the Alzheimer's Care Center open, and the hospital eventually closed it down, and they had this long-term care board, and then they were going to put the patients in this horrific place, and many had a great portion of those folks ended up dying within a very short period of time, but those places are even going to be closed down. So this is absolutely horrific, and these people who voted for him, who didn't think about anybody but themselves, are now going to FAFO, right? Because, I mean, we all are touched by these issues in our families, and they're going to be left with, maybe having to figure out how to care for their elderly family member who has dementia.
Surprise, surprise, the orange Cheeto Mussolini contradicted himself again, but this time it was on Medicaid cuts, because he first promised not to touch them during a Fox News interview, and then he endorsed a House GOP budget that includes nearly $880 billion in Medicaid cuts so that he can fund tax breaks for the wealthy. His administration obviously is saying that they're just cutting waste, fraud, and abuse, but they provided zero evidence that such waste actually exists on a scale that's large enough to justify the reductions. And even moderate Republicans have also warned that slashing Medicaid would be devastating for families. Beyond Medicaid, Mussolini contradicted himself again, but this time it was on Medicaid cuts because he first promised not to touch them during a Fox News interview, and then he endorsed a House GOP budget that includes nearly $880 billion in Medicaid cuts so that he can fund tax breaks for the wealthy. His administration obviously is saying that they're just cutting waste, fraud, and abuse, but they provided zero evidence that such waste actually exists on a scale that's large enough to justify the reductions. And even moderate Republicans have also warned that slashing Medicaid would be devastating for millions of families. Beyond Medicaid, Medicare and Social Security are also at risk now, and Senate Republicans refuse to support a measure that would be protecting Medicare and Medicaid. The Orange Cheeto Mussolini's team briefly included Medicare in its budget-cutting plans before backtracking once again, so we don't really know exactly what's going to happen, but we know that Social Security is also vulnerable, and this guy over here has already hinted at investigating fraud within the program, despite the Social Security Administration debunking claims of any sort of fraud. Orange Cheeto Mussolini's broader economic policies, such as his mass deportations and his new tax cuts and his tariffs, are all projected to just accelerate the depletion of the Social Security Trust Fund by 2031, which is actually 4 years earlier than previously expected. And obviously, the simplest solution for this would be to raise taxes on the wealthy, but that's obviously off the table for Republicans. So it's going to leave Social Security at risk of some major cuts. And despite the Orange Cheetos' reassurances to everybody, his administration and the GOP are already laying out the groundwork to slash Medicare, to slash Medicaid, and to slash Social Security so they can pay for tax breaks for the rich, of course. Good job, MAGA.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most.
It bothers me when people like Elon Musk say that people on those programs are the parasite class. It's just cruel.
Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
Trump promised a lot of things, like that it will be more family values and those programs that they really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare and Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
But his administration just proposed an $880 billion cut to Medicaid over the next 10 years. So we wanted to come here to find out how people are feeling about Trump and his administration's decision that could have a huge impact on one of the benefits they rely on the most. One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
Valerie have her medication for her seizures. She needs care of everything. And I just give massage to her hands, to her legs. I stay with her until she falls asleep.
It sounds like you take really good care of her.
Oh, my baby. It's my dog.
So you, your sister Irene, and your daughter Valerie, you're all on Medicaid. And how important is Medicaid for your family?
Can you imagine? We live on a daily basis with sicknesses. This is for the cholesterol too. This is also for my blood pressure.
So Medicaid pays for all of it.
Yes.
If you didn't have Medicaid, how much would this cost you? How much money?
Thousands maybe.
Thousands. And that's just for you,
That's
not for your daughter, not for your sister.
no. The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
When I was pregnant with my child, I was working in the field. I remember it was this little airplane and sprayed us. But when my baby born, the doctor just said, "Oh, something's missing." And when he gave me my baby doesn't have her arm.
So with these risks that you and your community face in agriculture, and then to have the system threaten to take away your health insurance, to take away protection, how does it make you feel?
Like I told you, I feel like this stabbing us in the back. You know, but why? Why when we put food on their tables? You know, that we risk our health. Look at me right now. Look at me how many sicknesses that I have. That COPD, I didn't have COPD at that time. We got all in the fields. Where else?
We're seeking permanent income tax cuts all across the board.
The $880 billion in Medicaid cuts proposed in President Trump's budget will help pay to permanently extend his 2017 tax cuts. The largest tax breaks would go to the wealthiest individuals. Are those your values?
No, that's not right. ¿Por qué van a hacer tanto recorte? Sí, tanto recorte. ¿En dónde lo van a poner ese dinero? ¿Dónde?
In the last election, who did you vote for?
I feel embarrassed to tell you. But before, all the years back, since I got my citizenship, I said I was a Democrat. But then, in these last elections, I voted as a Republican. Why? Because I'm against abortion. Para mí, la palabra conservador es tener valores. I grew up with values, you know, con las enseñanzas de mis padres.
Family values.
Family values.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to cut Medicaid.
The only people that are hurting are those poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
District 22's representative is David Valadeo, a Republican who voted in favor of the budget resolution to cut Medicaid, after initially voicing concerns about how potential cuts to social programs could affect his constituents. If just 2 Republicans vote no on the final legislation, they could stop Medicaid from being cut.
The folks in this district have voted for him because he, in the past, has been able to stand up against his party. But now he's really stuck between a rock and a hard place because it seems as if the Trump administration is going to really ask for loyalty from him and for him to play ball on every single issue, not just the issues that play well in this district. And so that might mean that they expect him to vote for things that are going to hurt his constituents directly.
If we could go back to November, who would you vote for now, seeing what you see?
Not either one.
You just wouldn't have voted.
Not either.
It's very sad that there's no political leadership that you feel you can vote for.
Maybe, they can, like you said, Democrat is Republican. Maybe they have, I'm not going to say that everything is bad, but the most important things. But the only good things is for them. To us, always going to be the good things,
You feel that way. It's always going to be the bad things
Always.
for you.
Insurance. I make $800 a month. oh, that will kill me. That would kill my friends.
So here's the reality. Medicaid, which of course formerly was known as Obamacare, is going to be cut, and people are going to lose so many benefits. They are going to lose a lot, and these are people who are literally depending on Medicaid to get medicine at affordable prices, because if they don't have Medicaid to help them to get those medicine which they need, believe you me, they will have to pay thousands and thousands of US dollars just to get those medicine, which majority of people cannot afford, which is the reality on the ground. And people are feeling it, and they're worried, because if the government has announced they're going to cut 880 billion Medicaid cuts in this budget, then what do you think is going to happen? Majority of the common people in America are going to suffer. And we can see here, literally, these are Trump voters who have voted, and majority of them depend on Medicaid. And right now they are worried, because if the Medicaid cuts go through, that means they cannot afford this medicine, which is helping them, to live their daily life. For example, those who are depending on diabetes, those who have celibacy, and many other ailments. Right now, they're depending on those medicines to keep them going, to keep them, surviving, and to go on with their daily activities. So imagine you live paycheck to paycheck. Then Medicaid comes, and your benefits they're removed. They cut your benefits. So what happens? You're being told, oh, you have to increase a few $100 to buy this certain of medicine. Maybe you're depending like 10 different type of medicine, so that you're able to to go on with your life, like what you see in the video. So you see, most people cannot afford. Most people cannot afford, and that is the reality. And yes, people should call their Congress and ask them, to stop this before it goes through, because if it does go through, a lot of people are going to suffer. So let's continue watching this video, and then let me know your comments, okay?
So this is for MAGA pro-life mothers. Now that we know that women and teenage girls are losing their lives in emergency rooms because of these healthcare bans that were put into place by Trump and other Republicans, and even if you believe this garbage about it being the doctors and the hospitals who are misinterpreting the law, what do you think is going to happen when your daughter shows up in an emergency room and has sepsis? Because they're not going to ask you who you voted for. They're not going to listen to you while you're screaming for them to help your daughter about how, oh, that's not what we meant. We meant some imaginary woman that we don't know, who's irresponsible, who wants to end her pregnancy. That's who we meant. We didn't mean my daughter, whose now organs are shutting down. So why don't you give that a think while you're at church this Sunday, praying for the unborn? So if you can imagine what that mother was going through in Texas when she was begging them to help her daughter, who had blood running down her legs and a fever. Think about where you would want to be in that position. Only you can save your daughter right now by voting for Harris and Democrats all the way down the ballot.
So Medicaid is very important to millions and millions and millions of people in America. Whether it's children, whether it's adults, whether it's veterinary, it helps millions of people to have access to medicine, to have access to affordable medicine. So if they do this budget cut, they are literally now going to cut 880 billion on Medicaid. That is a lot. So where is that money going to? Where is that money going to if they're going to do the budget cut on Medicaid? And then what will happen to the millions and millions of people in America who depend on Medicaid? What are going to happen? They're going to suffer, of course. That is the reality. They're not going to have access to medicine. Children will not be able to have access to medicine, to be able to be taken to the hospital to do checkups, because at the end of the day, if a parent checks and they realize they do not have the money to take their kids to the hospital, what are they going to do? They're going to tell the child, stay at home and try to do the home remedy, and which is not good. What about the elderly? What about the veterinary? What about the women who are pregnant? They all need to have access to the hospital. They all need to get access to those medicine. And if they do away with the Medicaid, what's going to happen? Medicine is going to be very expensive. medicine that they could afford through Medicaid. If they do the budget cut, believe you me, it's gonna cost thousands of dollars. And the reality is not many people can afford it. Millions of people cannot afford paying thousands of dollars going to go to the hospital. That is the reality. So what people need to do right now is basically to call your people, call them, tell them you do not want this Medicaid to go through. You do not want this budget cut to go through. They should do something in the Congress. All right, guys. So please don't forget to subscribe. I'd love to hear from you guys.